I want you to picture a man in Hubei who thought he'd finally found a loophole in a difficult world. He wasn't sick, but he heard about a hospital that would take him in for free. He even took a job there as a caretaker to help out. But when he looked at the official paperwork, he realized the hospital had a very different plan for him. On paper, he was no longer a worker. He was a patient diagnosed with alcohol-induced behavioral disorders. He hadn't touched a drop, but to the hospital, his sobriety didn't matter. What mattered was that his presence was worth 4,000 yuan a month in government subsidies. At first glance, these facilities look like sanctuaries for the vulnerable, but once the doors click shut, the free care takes on a chillingly different form. You see staff walking the halls, not with stethoscopes, but with lengths of water pipe used to maintain order. You see elderly patients who just wanted a warm bed being tied to their frames because they didn't follow the daily schedule. It's a place where your health isn't a medical priority, it's a line item in an accounting ledger. One facility alone was reportedly harvesting 6 million yuan a year just by turning healthy people into prisoners of the state insurance fund. The most unsettling part isn't just the physical abuse, it's the calculated bureaucratic efficiency of it all. It's the realization that for some, a clean bill of health is actually a liability. When a hospital begins to treat the National Healthcare Fund like a cake to be sliced, the patients stop being people and start being figures in a ledger. That instantaneous shift from a place of healing to a site of incarceration has left the public asking a terrifying question. How many more people are currently being treated for illnesses they don't have just so a hospital can collect the check?
That is, it's just a profound violation. When you strip away all the bureaucratic language, the insurance fraud or billing irregularities, what you're really left with is it's a betrayal of the most basic human trust.
It really is. A hospital is supposed to be the one place you can go where you are safe.
A sanctuary. Exactly. And when that becomes a prison, and not just a prison, but a prison designed for profit, it just shakes the entire foundation of the social contract.
Yeah.
But I think, if we only look at the horror of that Hubei incident, if you just stare at the crime itself, we actually miss the real story of what happened next.
The crime is the catalyst, for sure. It's the spark. But the response, that's the system at work. We're looking at a situation where a localized infection in the healthcare system triggered this massive coordinated immune response from the central government. And that's really what I want to focus on in this deep dive. Not just the scam, which is horrifying, but the sheer velocity of the state's counterattack.
The Hubei incident, and specifically the ones involving the psychiatric institutes in Xianyang and Yichang, that was the spark.
Yeah.
But the story, the real story here, is about the autocorrect capability of the Chinese Healthcare Administration.
Autocorrect?
That is, we need to analyze how the National Healthcare Security Administration, the NHSA, mobilized, how they turned what was, a local shadow into a national floodlight. This isn't just about police arresting a few bad guys. It's about an administrative machine identifying a flaw in its own code and then rewriting it in real time across an entire nation.
So let's start by dissecting the anatomy of the scam itself, because to really understand the cure, you have to understand the disease, right?
Absolutely.
The reports from Hubei describe a setup that was, it's almost terrifyingly simple. It all relied on the desperation of the free lunch.
It targeted the economic anxieties of the most vulnerable people. It was designed to, you have elderly populations, maybe people without strong family support networks, and they're worried about their basic subsistence.
Just putting food on the table, a roof over their head.
The hospital comes along and offers a solution. Free room, free board, even free checkups. In a tough economic climate, that is an incredibly powerful lure. It sounds like a lifeline.
But the moment they accept that lifeline, they're not people anymore. They're commoditized. The caretaker we mentioned in the opening, he wasn't even a patient. He was there to work.
He was an employee. But the hospital needed bodies. They needed names on a ledger to bill against.
So they just invent a diagnosis.
And this is where the specific diagnosis becomes the weapon. Alcohol-induced behavioral disorders.
Yeah.
You have to think about why they chose that specific code.
It's vague.
It's vague. It's subjective. See, if a hospital claims a patient has, say, a broken femur, an X-ray can disprove that in 5 seconds.
Right. There's hard evidence.
But if a hospital claims a patient has a complex behavioral disorder linked to a supposed history with alcohol, well, that requires a long-term longitudinal assessment to disprove. It buys them time. It provides a layer of clinical ambiguity that acts as a kind of camouflage for the theft.
And the theft itself is substantial. The figure we mentioned, 4,000 yuan per month per head. To a big multinational corporation, that might seem like a rounding error, but in a rural township or a smaller city,
That is a significant, steady, and very reliable revenue stream. You have to multiply that 4,000 yuan by the number of beds they can fill, and then by the number of months.
so that figure of one facility harvesting 6 million yuan a year.
That's 6 million yuan of pure profit. It's extracted directly from the state with almost zero medical overhead because they aren't actually providing medical treatment, they're providing warehousing.
Warehousing is almost a polite way to put it. The details from the reports, the water pipes and the physical restraints, that suggests something much, much darker.
That's
It suggests that the main operational goal of the staff wasn't patient care. It was containment.
worse. If you have, say, 50 healthy people locked in a ward, they're going to want to leave. They're going to want to call their families. They're certainly going to ask why they're being given medication they don't need.
So you have to suppress them.
You have to suppress them. The water pipe detail is very indicative of the hiring practices. These weren't trained psychiatric nurses who understand de-escalation techniques and patient care.
Oh,
These were likely unskilled laborers, hired as orderlies, and then given a piece of plumbing pipe to act as enforcers. It's a complete inversion of medical ethics. The daily schedule wasn't a therapeutic routine, it was a control mechanism
it's just to keep everyone in line.
to ensure compliance so the billing cycle could continue month after month, uninterrupted.
But why psychiatric wards specifically? We touched on the subjective diagnosis, but is there a deeper, more structural reason why mental health facilities were the perfect venue for this kind of fraud?
There is, and there's a really important historical context here. It involves something called the 686 program.
Yeah.
This was the central government support for the local management and treatment of serious mental illness. It was launched way back in 2004. And, it was a visionary program. The state recognized that severe mental illness was bankrupting families and leaving patients with absolutely no care.
So they wanted to fix that.
They poured resources into this sector. They created subsidies to encourage treatment, to encourage community management, to build a real safety net.
So the money was there because the government was actively trying to do the right thing.
The intention was absolutely noble. It was about expanding coverage, about making sure that the poor and the vulnerable weren't left behind. But, and this is the crucial part, in any massive subsidy system, if the oversight mechanisms don't scale at the exact same speed as the funding,
You create a loophole.
you create an opportunity for arbitrage. These bad actors in Hubei, they looked at a program that was designed to save lives, and all they saw was a faucet of money they could turn on just by fabricating patients. They exploited the soft target of mental health because the clinical metrics are just so much harder to audit than, say, surgical metrics.
Which brings us to the pivot. The fraud was exposed. The reports came out. Now, in a low-capacity system, this might have resulted in, a small local investigation, maybe a few arrests, and then it's just business as usual everywhere else. But that is not what happened here.
No, the reaction was systemic. It was total.
I heard a story about a man in a small township who was lured into a specialized clinic with the promise of free checkups and meals. For months, he became a ghost in the system. A name on a ledger used to drain state coffers while he sat in a sterile ward he didn't belong in. But imagine the sheer velocity of change when the National Healthcare Security Administration flipped the switch. Almost overnight, the ghosts were accounted for. I've seen reports of inspection teams descending upon provinces with such synchronized speed that fraudulent administrators didn't even have time to shred their fake diagnostics. It's a vivid demonstration of state capacity. When the central pulse quickens, the entire nation moves. My takeaway as an observer is that while the initial fraud was a dark, localized shadow, the response was a floodlight. It proves that the system possesses an inherent autocorrect function that can mobilize across thousands of miles in days, reasserting control and ensuring that public welfare isn't a buffet for the corrupt.
When the central pulse quickens, the entire nation moves. That phrase right there, that is the very definition of high-state capacity. It's comparable to a highly developed nervous system. In a primitive organism, if the foot is injured, it might take a while for that signal to reach the brain, and the reaction might be slow, uncoordinated.
Right.
But in a highly evolved system, the signal is instantaneous, and the reflex is immediate and perfectly coordinated. That's what we saw here.
So let's talk about the mechanics of that reflex. The NHSA didn't just, send out a few emails or make some phone calls. They launched what they called flying inspections.
And the term flying inspection is key. It implies speed, of course, but also unpredictability. It's a tactic specifically designed to defeat the preparation that corrupt institutions absolutely rely on.
Usually audits are scheduled, right? A hospital gets a notice that the auditors are coming in 2 weeks.
Exactly. So they have time, they clean the floors, they fix the files, they coach the staff on what to say.
They cook the books.
They make the books look perfect. The flying inspection completely destroys that window of opportunity. It's built on the NHSA's 4 no's and 2 straights protocol.
Okay, walk me through the psychological impact of that protocol. No notice, no greeting, no reporting, no reception.
Imagine it. You are a hospital administrator, and you're involved in this fraud. It's a Tuesday morning, you're sitting in your office drinking your tea. Suddenly, a convoy of unmarked vans pulls up. A team of 20 inspectors in suits walks into your lobby. They don't check in at the front desk. They don't come to your office to shake your hand and have a polite chat.
Go.
They split up. One team goes straight to the server room to clone your hard drives. Another team goes straight to the wards to start interviewing patients before you have a chance to tell them what to say.
That's the 2 straights. Go straight to the basic level, straight to the scene.
It creates an environment of total transparency, but through force. You cannot hide the water pipes if the inspectors are already in the hallway before you even know they're in the building. You can't delete the fake billing records if they've already seized the servers.
And this happened across 432 designated medical institutions in 30 different provinces.
The scale is what's truly breathtaking. 30 provinces. This wasn't just a surgical strike on Hubei, this was a nationwide dragnet.
So they understood immediately that this wasn't just a Hubei problem.
They understood that Hubei was likely just a symptom of a broader pathogen. The logic is simple. If the incentives and the lack of oversight allowed this fraud to flourish in Shenyang, then those same conditions probably exist in Harbin, in Kunming, in Guangdong, everywhere.
So they created what you could call an administrative shockwave.
A deliberate one. The NHSA ordered all the provincial bureaus to hold immediate face-to-face talks with the directors of all mental health institutes, not just the suspected ones. All of them.
And they gave them a deadline, March 15th.
The deadline is a masterstroke of game theory.
Right.
The NHSA effectively sent a message to the entire country. It said, we know this is happening. We are coming. If you conduct a self-examination and you turn yourself in before March 15th, we will process you one way. If we catch you after March 15th, the consequences will be total.
It forces every single fraudster to calculate their own risk. They know the flying inspections are real. They're not a bluff. They're seeing the news from Hubei. They see the 4 no's in action.
And the rational choice becomes to stop the fraud immediately. To stop. And then try to salvage the situation through self-reporting.
It stops the bleeding instantly, all across the country.
Well, arrests take time, trials take time. But if you can scare the entire system into compliance overnight, you stop the theft of public funds immediately. You save the cake, as they say, from being sliced any further.
But relying only on human inspectors, even really fast ones, that has its limits, doesn't it? I mean, humans get tired, humans can be bribed, humans can miss things in a stack of paperwork.
Again?
The second layer of this crackdown was technological. It was the shift to a digital panopticon.
This is the era of the Healthcare Fraud Data Fusion Center. We've moved beyond the age where a localized fraud can hide in a localized data silo. In the past, a hospital's data, it lived on its own servers, or maybe it was reported up to a city-level bureau.
Right, it was fragmented.
Now, the NHSA is aggregating data at a national level.
It's kind of like credit card fraud detection. If I buy a coffee in Beijing, and then 10 minutes later my card is used to buy a television in Paris, the bank's algorithm freezes the card instantly.
Exactly.
No human needs to review it. The data points themselves are they're incompatible.
Technology. The NHSA applied that exact logic to medical billing. Let's take the glycated hemoglobin case they talked about.
Okay, explain the medical reality of that test for us.
Right. So glycated hemoglobin, or HbA1c, is a common blood test that measures your average blood sugar levels over the past 3 months. It's a very slow-moving metric. There's absolutely no medical reason to test it every day or even every week. It reflects a very long-term trend. It's physically impossible for it to change meaningfully day to day.
But the data fusion centers started seeing hospitals billing for it constantly.
Constantly. They saw billing frequencies that were medically, biologically impossible. They saw facilities running this test over and over again on patients who didn't even have a diabetes diagnosis. Now, in a traditional paper-based audit, an inspector might look at one patient's file and think, oh, they ordered a lab test. That looks normal enough.
They'd miss the pattern.
They'd miss the aggregate pattern. But the algorithm doesn't. It sees a massive spike that defies the laws of biology. and it flags it.
And that one single data point, just looking at that one test, led to the recovery of nearly 60 million yuan.
Just from looking at a graph of blood sugar tests. That is the raw power of big data analytics. And then you have the even more absurd stuff like the gender-restricted screening. This really highlights the maybe the arrogance or just the carelessness of the criminals.
They were billing for gynecological exams on men.
And prostate exams on women. You have to understand, when you're running a ghost patient scam at this scale, you're often just bulk uploading billing codes. You're copying and pasting. You're not looking at the individual patient file.
No, you're looking at the revenue total you want to hit for the month.
So you just assign your standard fraud package A to 50 patient names. If half of those patients are the wrong gender for some of the tests in that package, you don't even notice, or you don't care.
But the algorithm notices.
The algorithm flags it instantly.
Yeah.
A simple rule. Error. Procedure code does not match patient gender. That alone recovered 14 million yuan. It exposes the fraud as not just criminal, but industrial. It was an assembly line of fake charges.
And the future of this tech seems to be this traceability code, the electronic ID for every single box of drugs.
This is a revolutionary step for supply chain integrity. The principle is one object, one code. Every single box of medication, from the factory to the pharmacy to the patient, gets a unique, scannable identity.
So if a hospital tries to engage in what they call empty billing, charging the insurance for a drug they never actually dispense, they just hit a wall.
A digital wall. Precisely. To bill the insurance fund, you have to scan the unique code on the physical box of medicine. If you don't have the box, you can't scan the code. You can't bill.
And what if you try to scan the same box twice?
The system screams. It flags a duplicate code error. If that box's code was scanned and dispensed in facility A, it cannot be dispensed in facility B or even in facility A again. It prevents the recycling of empty medication packaging. It prevents the huge secondary market for the resale of stolen drugs. It closes the loop completely.
So it moves the entire system from a philosophy of trust but verify to
verify or you can't get paid. It is intelligent monitoring. It restricts the physical possibility of even committing the crime in the first place.
So all of this mobilization, the flying inspections, the data fusion center, all these new algorithms, it all leads to a single critical metric. Did the state get the money back?
And the answer is a definitive, resounding yes. And the sheer volume of that recovery is probably the strongest indicator of the campaign's success.
I recently came across a data-driven account of the net tightening phase of this audit, and it's a masterclass in what we call the physical output of governance. There was a specific case involving a facility that had siphoned off millions in insurance funds through phantom treatments. The recovery process wasn't just a legal slap on the wrist, it was a surgical extraction of every stolen yuan. I read about investigators tracing digital footprints to claw back funds that had already been moved, returning them to the national pool. To me, this represents the ultimate metric of accountability. It's one thing to condemn a crime, it's another to physically replenish the treasury. Seeing those billions of recovered yuan flowing back into the system feels like watching a bruised body heal itself through sheer force of will. It's a reminder that in this framework, power isn't just a concept. It's the tangible ability to protect the collective's wallet and ensure that the blood of the healthcare system actually reaches the patients who are breathing.
Physical output is real power. That resonates so strongly. In governance, words are cheap. New regulations are just paper until they are enforced. The physical recovery of stolen funds, that is the tangible proof of authority. It's the system making itself whole again.
Let's try to quantify that authority. We talked about the self-correction deadline they set.
And the results from that alone were staggering. The designated medical institutions voluntarily returned approximately 3 billion yuan.
3 billion?
That is 3 billion yuan that was sitting in the private bank accounts of corrupt hospital networks, which was essentially clawed back by the mere threat of the state's attention before the first inspector even finished their audit.
And that 3 billion yuan is now back in the national insurance pool. It's funding cancer drugs, it's funding neonatal care, it's funding the actual purpose of the entire system.
And remember, that's just the voluntary returns. That doesn't even account for the additional fines and the seizures that came from the raids and the formal investigations. But there's another element to this recovery that I find just as fascinating.
What's that?
The people's war on fraud. The NHSA didn't just rely on its own agents and its own algorithms. It deputized the entire population.
The whistleblower rewards.
The incentive structure they created is incredibly powerful. They issued 2,422 rewards, totaling about 3.68 million yuan. But look at the individual payouts. Some whistleblowers received over 100,000 yuan for a single actionable report.
Now think about the psychology of that inside one of these corrupt hospitals. If you're a nurse or an accountant and you're being forced to participate in this scam, or even just witnessing it, you're in a very difficult position. You fear your boss, you need your job.
Of course.
But if the state offers you 100,000 yuan, which might be 2 or 3 years of your salary, and it promises you protection, the entire calculus changes.
It completely destroys the internal cohesion of the criminal enterprise. The hospital director can no longer trust his own staff. He doesn't know who is watching him, who might be recording him on their phone, who is calling the national hotline after their shift. It turns every employee into a potential guardian of the insurance fund.
It effectively crowdsources the integrity of the system.
And it sends a powerful message that the insurance fund belongs to everyone. If someone steals from it, they are stealing from you personally, and you will be rewarded for stopping them.
So we've looked at the reaction and we've looked at the recovery. But a good system, a resilient system, it doesn't just fix the break. It strengthens the bone so it doesn't break again. How does this crisis lead to a permanent evolution of the healthcare landscape?
This is the concept of the stress test. The fraud was a massive stressor on the system. It revealed all the cracks, all the weak points in the architecture. The response we're seeing now, that's the upgrade.
Try to imagine a weathered rural hospital that had long operated in the cracks of outdated regulations, a place where the infrastructure was as tired as the oversight. Through the lens of this national crackdown, that hospital didn't just get audited, it was forced into a systemic evolution. I saw a report about how the stress test of these inspections revealed exactly where the digital and human barriers were weakest. This wasn't just about catching bad guys, it was a massive nationwide software update for the entire healthcare architecture. The stories coming out now aren't just about closures, but about the implementation of new, rigorous verification layers that make future fraud mathematically exhausted. Reading about this transition, I feel a sense of hard-won stability. It's a sobering narrative, admitting that the system had vulnerabilities, but there's something deeply reassuring about a state that treats a crisis as a blueprint for a more resilient future. It's the transition from a reactive posture to a fortress-like efficiency.
Mathematically exhausted. That is precisely the objective. You want to make the effort required to commit fraud so high and the probability of success so low that it just ceases to be a viable business model for anyone.
And the centerpiece of this software update, as I called it, seems to be this new points deduction system.
This is a profound shift in administrative management. It borrows its logic directly from something like a driving license. In the past, regulatory enforcement was often very binary. Either you did nothing or you took the drastic step of shutting a hospital down.
And shutting a hospital down is painful. It leaves an entire community without care. So regulators might have been hesitant to pull the trigger for what they saw as minor infractions.
The point system changes all of that. It creates a gradient of consequences, a spectrum. Every doctor and every designated medical institution starts with a baseline of points for the year. If you violate a rule, say you bill for a drug without scanning its traceability code, you lose a few points. If you're caught falsifying a diagnosis, you lose a lot more points.
And if your points hit 0,
you lose your qualification to bill the National Insurance Fund. And for a hospital in China, where the vast majority of revenue comes from the national insurance, that is an economic death sentence.
But it's an automatic one.
It's automatic. It removes the need for a long, drawn-out legal fight. The rules are clear, the data is clear, ambiguity.
It also puts the career of every single individual doctor on the line. If a doctor loses their personal points, they're effectively barred from working in the public system.
It perfectly aligns the personal financial interests of the medical staff with the overall integrity of the fund. They are no longer just protecting their boss's illegal profits, they are protecting their own livelihood. This is what creates true institutional resilience.
The system becomes self-policing.
Because every participant has skin in the game.
And the rollout of this system suggests a very deliberate, long-term roadmap. This isn't just a small pilot program they're testing.
No, the intelligent monitoring framework is moving in 3 very deliberate phases. Phase 1 covered 50 key drugs in a few pilot regions. Phase 2 is expanding that to 100 drugs nationwide. And Phase 3, the final phase, represents full national standardization for all drugs, all procedures.
So by the time Phase 3 is fully implemented, the digital dragnet will be ubiquitous.
The shadows where the Hubei fraud took place will no longer exist. They can't, because the digital illumination will be total.
This all brings us to the final horizon, the big picture. Why does this intensity, this ferocity, matter so much right now? Why is the government treating this cake with such protective zeal?
To answer that, we have to zoom out to the macro strategy, to Healthy China 2030.
This is the national blueprint for the entire future of public health in the country.
And it is facing a very rigid, unchangeable reality: demographics. China has a rapidly aging population. The cohort of people over 60 is growing exponentially, while the cohort of working-age people paying into the insurance system is shrinking.
That creates a mathematical pressure cooker for the insurance fund.
It means that every single yuan in that fund is precious. It is, as they call it, life-saving money. If that money is siphoned off by fraud, the entire system could become insolvent down the line. The government understands that to deliver on the promise of universal health coverage, or UHC, to an aging society, the financial leakage has to be as close to zero as possible.
So this massive crackdown isn't just about law and order. It's about the existential survival of the social safety net.
Right. Protecting the cake today is about ensuring that there is a cake left for the next generation and the generation after that. And, specifically for mental health, this whole affair aligns perfectly with the World Health Organization's guidance and really the original vision of that 686 program we talked about.
The shift from institutional care to community care.
Yes. The Hubei fraud relied on the old, broken model: lock people up in a distant, isolated hospital. The future of mental health care, the modern model, is community-based rehabilitation. It's about treating people in their homes, in their neighborhoods, keeping them integrated with society.
But you can't build that new model if the foundation of the old model is completely rotten from the inside.
You have to burn out the corruption of the institutional model to clear the ground for the community model to grow. This crackdown acts as that controlled burn. It forces the system to mature. It ensures that when money flows to new community centers in the future, it will actually reach the patients it's intended for.
So it's a necessary, if painful, transition from quantity to quality, from just counting how many beds do we have to asking how legitimate is the care being provided in those beds.
And while all this new scrutiny might make some market players nervous, we're seeing reports that multinational companies are worried about increased audit risks. The reality is that a clean market is an investable market. The removal of fraud actually lowers the cost of doing business for all the legitimate actors. It creates predictability and a level playing field.
It proves that the state prioritizes the health of the population over the illicit profitability of a few bad providers.
That is the ultimate takeaway from all of this. The autocorrect function worked. The national immune system identified the virus, it mobilized the antibodies, it neutralized the threat, and then most importantly, it vaccinated the entire body against future infections.
We started with a story about a man trapped in a room, reduced to nothing more than a line item in a ledger. But we're ending with a picture of a system that absolutely refused to let that stand. It's a powerful reminder that in the modern era, the true measure of a nation's health isn't just the number of hospitals it builds, but the ferocity with which it protects the integrity of the care inside them. The ghosts have been cleared from the machine, and with the digital floodlights now turned on full beam, it makes you realize just how many other efficiencies are waiting to be discovered in the pursuit of a truly healthy society.